Hello, everyone, and welcome to our penultimate Hangout with Art, our second to last Hangout with Art for the Milwaukee Art Museum's Hangout with Art online course. We are so glad that you have joined us today for this talk with Dr. Jackie Irland, who's here with us today, as well as Caitlin Martell, who is a participant in one of Dr. Irland's classes. We'll go into that more in detail in a moment. But for now, I wanted to introduce myself. I'm Chelsea Kelly, the manager of digital learning here at the Milwaukee Art Museum. And this is part of a series of 6 Hangouts that we're hosting here at the museum about thinking about how we can use art in our lives. So the online course that we've been doing called Hangout with Art, which can be found at courses.mam.org, is a massive open online course for folks from around the world to get more comfortable looking at art and going to museums. And for the past 2 months, participants have been doing different activities to do just that. And in the second half of the course, we are featuring conversations with experts in their fields who use art in their work but don't necessarily work at museums themselves. So as I said, we're excited to highlight today's theme, art and health. In our live talk today, we want this to be as conversational as possible. So we encourage you to use the Q&A feature in the Google Hangouts. If you're tuning in on Google+, you can hover to the right side or to the left side of your screen and you'll see a button that says Q&A. And we encourage you to submit questions for our speakers and I will work them into the conversation. I think that's about it as far as housekeeping. We're very thankful to the Google Art Project for partnering with us on this project, as well as to the Google Jumpstart Your Course grant for funding the project as well. So let's get going. I want to start by introducing our speaker. This is, you can see her in the bottom box there, and we'll have her come up to the full screen in a moment. This is Dr. Jacqueline Irland, who specializes in obstetrics, gynecology, and she has a special interest in pain management during pregnancy and childbirth, and she uses various art forms in her approach, which she'll tell us more about today. Dr. Irland earned her degree in medicine from the Michigan State College of Human Medicine in 1986 and completed her residency at Hurley Medical Center in Michigan. And now she is based here in Milwaukee. She's board certified and an assistant clinical professor of obstetrics and gynecology at the Medical College of Wisconsin. And again, Caitlin Martell is our other guest in this conversation, who was a participant in Dr. Irland's classes. So Dr. Irland, Jackie, I will turn it over to you to tell us a bit about your work.
Okay. Well, I'm very, very happy to be here. This is very exciting because I don't usually get a chance to do this kind of thing. A little bit about my background. I have been practicing obstetrics for about 30 years, and in the past 15 years, I've started using some different techniques to help moms get through labor. What I found early on was that I had a lot of patients who didn't want to use epidurals or a lot of interventions, and so I started looking for things that might help them with this. And one of the things I started using and learning about was self-hypnosis. And since that time, I've developed programming for both nurses who are helping couples get through labor and also couples so that they can go as far as they want to go without having interventions. Probably I've worked with, I know I've worked with several hundred couples over the past 15 years and several hundred nurses in the Milwaukee area as well. The reason I've used hypnosis, and I'll get further into how I use art with that, is that it can be a real help with pain, with anxiety, with procedures. It helps to stabilize our bodies, and especially in labor, if moms are calm, there's more blood supply that goes to their uterus, and so the babies do better, which is kind of the bottom line for me. But as I started using hypnosis, I realized that so many of the people that I was working with, had maybe one way that they looked at the world more than others. They might be more visual or more tactile or more auditory, and so I started developing ways to help them enhance their experience and also their learning to be able to use this more and more in labor. And so today I'm going to be talking more about probably the visual part of that. And let me give you a little bit of information about just what hypnosis is. It really is something that all of us do every day. I mean, when we're driving to work and we know our way and we're not paying much attention to the road, we're thinking about things. Part of us is driving and part of us is thinking about our day. And so we know how to dissociate our minds to do two things at once, which is one of the things I teach when moms are in labor, is that they know they're in labor, but then they can imagine that something else is going on. And during that time, if moms are using hypnosis, they're using basically the technique which helps them focus, they get absorbed, and they're also more suggestible, so that I can suggest things to them that might be helpful to them, and they can make use of those things. So one of the things that I found has been really exciting about the use of hypnosis for medical problems or labor is that it really engages that creative part of our mind, whether that's the right brain or some other part. It's a part of the mind that knows how to go beyond the limits of just the lines around our life. We can do colors, we can change our perception of things, we can change how things look or how things feel. And that creative part of the mind can come up with all kinds of amazing things that help us get through especially painful experiences, which is the case often with labor. I tend to use a lot of storytelling when I'm teaching my couples to use this, and in doing that, helping them develop some visual images. I know when we talk with Caitlin, who's been through this, she's very visual, and so she used Paris as one of the ways that she got through labor, in a very long, difficult labor. I also help couples learn that this is an adventure, that they're on together, and that by the yes, by the end,
Definitely.
yes, they they will, by the time they're in the middle of this, they will have everything that they need for that adventure to get through successfully. And the more sensory kinds of things that they can use, the more of their senses that they can use, visual, auditory, kinesthetic stimuli, or things that will help them get through, the easier that is and the better it is for them. And but again, some people are very visual, and in that case, I will use mostly visual kinds of things to help develop metaphors or images that can help them change what's happening in labor. One of the things that's true about labor that many women and couples don't realize is that most of the labor is actually resting. The contractions are only really 1/3 to 1/4 of the labor process. The rest of the time is resting. And you can use all kinds of things to help you get through the contraction, imagining, as Caitlin did, that she was in Paris. Maybe was climbing or doing something difficult there, and then afterwards she could be resting in a really beautiful area there. Some women will end up climbing hills or bicycling, or sometimes even struggling over the contraction, getting to the peak and starting down the other side, and then they'll use whatever images that are important to them to help them rest during that time in between, because that's the time that the uterus fills up with blood and gets all kinds of oxygen and nutrition to the baby. So the calmer the mom is, the more oxygen and nutrition the baby gets, and the more likely that the baby will have an easy time during this process. There are some things, which, and I guess we could even go in right now to one of the slides just to show you how I might use that before we see what kinds of other things Caitlin may have to offer to this, since she's actually gone through this. Unfortunately, when I had my children, I didn't know about it, so I didn't get a chance to use it in the way that she did. So do you want to go to just slide 1? Okay. Now, one of the things about these, when I'm teaching visual images, I use Georgia O'Keeffe a lot, because I love her images. I love what she does with things that are just normal everyday things, and she changes them. She changes them in a way that the unconscious mind would be seeing those, so that in a kind of a dream state, daydreaming, these are the ways we might look at some of the things that are around us. On I believe it would be the left side of the screen, you have a cow pelvis with a moon. And so moms who are visual, they may find that they can imagine that they're pushing their baby out through that hole in the pelvis out to the moon, or maybe out to the sun, or out to something else. And so I've had a number of moms who have found that they can just imagine their pelvis and think about their pelvis, and not really think, but really it's imagining, experiencing that the labor pains as something that is allowing them to push their baby through that hole, out into the universe, or out to the stars, or out to the moon. On the right side, you see the painting is called Blue 2, but it kind of looks like a uterus with a fetus in there, or a baby. And I've had moms who have imagined that their uterus and the inside of their uterus and the baby were maybe a red color, which was kind of an angry, upset, uncomfortable color. And so they'll work through a contraction, imagining that they're turning it into blue, which is calming and soothing to them, and that it might in fact look like her Blue 2. And so when I'm training couples, I'll show them these and say, this is what it might look like to you. So that as they're learning to do this, they have some perspective on what things might look like in their unconscious or in that creative part of their mind, which is very different from what it looks like if they would take a picture, or draw something, a stick figure. Anything to add to that, Caitlin?
Whew.
I talk fast. So
you do. I was sort of reminiscing, Dr. Irland, one of the last things my husband and I did before Kyriakos was born is we actually visited here at the Milwaukee Art Museum the George O'Keeffe collection, which is a pretty big deal here. So some of the last photos I have of him and myself before the baby were actually like in front of George O'Keeffe paintings.
Oh, wow.
So that's kind of nice memory. So.
And actually, I think we do have on the PowerPoint, we do have a couple slides of some artwork from our collection of George O'Keeffe paintings.
Yeah,
it's
slide
the last
4?
slide.
The
fourth slide. Yeah. I'm sure it'll come up in a second, but that's really lovely to have that kind of connection, not just in your mind of the works of art, but also in, physically to come and see those artworks. And those are just a couple in the collection here at the Milwaukee Art Museum.
Can I say something about
I think I have a picture of him in front of the cliff chimneys.
Brilliant.
Photography is allowed of that one.
Okay.
Well, let me say something about on the right, the cliff chimneys. One of the things that was extraordinary experience. I was at a workshop in Santa Fe where George O'Keeffe has a museum, and we were lucky enough to be there at a time when they showed photographs, and then next to them her paintings. And so you're looking at something that's very, simplistically left brain, and then looking at something that's very right brain. And it was so interesting to see that things that I didn't necessarily notice in the photograph she would bring out in the painting. Like I didn't notice the green of the trees. I didn't notice that in fact there were pink areas on the cliffs. And then she would bring that out, and actually that would be a major part of her painting that was there, but you just didn't notice it looking with the left side of your brain. It wasn't something that stood out. And so that's one of the things that happens when someone is using hypnosis, is that as they're imagining, certain things may stand out that would not necessarily be there, or that they would notice. Also, they start learning that it's okay during the labor experience to have certain things be more important than others. It's okay to forget some of the things that are uncomfortable, or things that people may do or say that weren't helpful, and really remember some of the things that were very helpful or that were wonderful as soon as they feel their baby come out and the baby's on their chest, remembering that as opposed to remembering other parts of the labor, which is very much what George O'Keeffe does in her paintings. And so we use that. And I think even if you go to slide 2, I've had moms who imagine that the baby was in a Nautilus. And it might look something like this, and often it does when they describe it, that they see the baby coming from the middle, moving along the spirals, getting closer and closer and closer with every contraction. And so they can imagine that in fact, they know they're in labor, but what they're imagining is that their baby is actually in this Nautilus. And every push and every contraction, they're bringing the baby out more and more into this world. Or when they're resting, they may feel that they're resting on a bank of clouds that might look like George O'Keeffe's, and I don't know, I guess it's above the clouds, is the name of that. And so it may look like that to them. It doesn't look like it does when you're looking out an airplane window, because that part of the mind that's imagining this sees it very differently. And so it can be very helpful to look at some of these kinds of images so that when they show up and someone's in a hypnotic state, they're going like, wow, what is that? They know what it is. It's like, oh, those are clouds, but it doesn't look like clouds that I would normally see on the outside world, the left side of my brain. These are different clouds. These are the clouds I'm imagining. Anything you want to add to that, Caitlin, or any?
Oh boy, yeah. I mean, well, I will say that these images of George O'Keeffe or things that you look at beforehand that you find really beautiful or calming or places that you want to be do come back to you, because you can bring things into your imagination when you may in fact be, you know, ready in a room surrounded by doctors and nurses and lots of noise and machines beeping. Like, if you can bring it inside and use your imagination, you could float on clouds or just, transport yourself away from the things that aren't really helpful for you.
And you practiced certain, your images, and you told me, and I'd forgotten about this, that when you were in recovery, one of the nurses knew about that.
Well, actually, while I was in labor, we induced. I went through that whole process of Pitocin and everything, and it took 3 days, and so it was very intense, and there were frequently teams of nurses coming in and trying different things, and at some points it was very painful or overwhelming. At one point, my nurse, who I will only always know as Kim, she's like holding my left hand, and she goes, "Go to Paris, Caitlin, go to Paris," and I'm like, "Oh, how did you know?" So somebody, probably my husband, told her that was like what I wanted to visualize, and then I kind of mentally started walking down the street that I had been down with my husband and transported myself to a much happier romantic place. So it was nice.
And you were very good at that, and to be able to just simply go to that, and you practiced it when it was suggested.
And it was like if she was in my head, she knew. So that was interesting.
So maybe it could be useful to, I definitely have some questions to even just initially to ask, but I wonder before we dive in, and again to those watching, please do send us in any questions you have, but maybe as we're thinking of questions, could you tell a little bit more? You mentioned at the start that you use different kinds of art forms too, kind of depending on a person's if they're a visual person, if they're if they're auditory. Could you say a little bit more about different art forms that you might use in this process?
Yeah, and I will use forms that they can bring with them, and so actually I have, and I don't know if I could hold them up here. I mean, I collect marbles, so I have all kinds of marbles that I use that they have colors, they have some of them have texture, and so I have the moms and the dads learn how to look at these, hold on to them, feel the weight, feel the different surfaces, feel the temperature, memorize the patterns that are on them so that they can use this as a focal point in labor. So some moms will bring those, some will bring different kinds of textures. If I was in labor, I would have a chenille throw that I love. And so when I'm practicing self-hypnosis, that's what I use because it's soft, it's heavy, it's warm, and so when I use that kind of tells my mind, okay, we're going to practice hypnosis now. And so that left side of my brain, which is often tough to get to shut up, just is quiet. So I have moms bring things that might help them go ahead and go into a hypnotic state more easily. I usually will have them put together a playlist of sounds. It could be waves, and river sounds seem to be really helpful for labor, but also it can be all kinds of other music that they especially like. I think and it's so different for everybody. I tell a story of a couple many years ago, towards the beginning of when I was teaching hypnosis, where I came in to deliver their baby, and the nurses said, well, you probably should put earphones on before you go in because when you walk in, it's going to be really loud. So I walk in, and they're both zoned out and listening to Iron Butterfly singing In-A-Gadda-Da-Vida. And just totally zoned out. I look and go like, okay, well, that wouldn't get me calm, but they were totally calm, and that's what they delivered their baby to. And it could be, a mom could be listening to waves for 24 hours or river sounds. At one time, there was a lot of Celine Dion and Josh Groban, you know, and of course the dads would get tired of that, so I was given lots of CDs, you know, Josh Groban and Celine Dion, that the dads would say, like, okay, would you take these? I don't think I can listen to anymore. But for the mom, that's what she needed to listen to. So that helped her become more focused and helped her dissociate, in a sense, from what was going on around, even though she knew she was there. I mean, an example from me personally is I've used hypnosis and lots of images and sensory kinds of things with procedures. When I've had crowns done, I don't have them use any local anesthetic. I normally have my playlist, and I listen to sounds, and I usually have a marble, and I imagine something that I'm doing with the marble. Now I know what the dentist is doing to me, but I choose then to just go and imagine that it's something else. You know, I've done that during colonoscopies. I had knee surgery where they had to take and saw off parts and hammer parts. I know, and so that now, like, I had a spinal, so it wasn't totally, but I didn't have them put me to sleep. Instead, I imagined when some of these were going on that I was sawing down Christmas trees, or that, you know, when they were sawing, or I was I was on a rafting trip, which I did a lot of in my youth, and that I was going over rocks and roots, and so those. I could almost hear those things, and because I was listening to water, I could imagine that even better. But then I could see it happening. I could imagine how that was feeling. And so, although again I knew where I really was imagining that I was someplace else, which again it's a great creative feat that we have. Our minds are so powerful. We have the ability to imagine things happening, you know, and changing our perception and calming our body in ways that I think we're just starting to understand and be able to use.
And I have to add here, if you've been following our previous Hangouts in this series as a participant of the course, a big theme in what we've talked about a lot is storytelling and imagination. We had a children's book author come and speak to us about her young adult novels, and a huge theme, of course, for her was imagination and using artworks to inspire a narrative or to inspire a story. And this is really a great kind of connection to kind of take it even further. So using, you know, of course, using art as a way to be creative, tell a story, tell a narrative, but to even kind of take it into the realm of kind of mental well-being and use it as a pain management tool to help kind of manage those kinds of difficult moments. So I have a question for you. So I have done some meditation, and what you're talking about sounds very similar to some of the meditation practices that you know, I've been taught or that we might, you know, be familiar with. So I wonder if you could talk a little bit about the differences between hypnosis and self-hypnosis and meditation, or any similarities between the two.
Sure, that's a really common question, because it seems like, and actually the feeling inside is very similar to when someone's in a deep meditative state. I mean, for me, you know, I tried meditation, I remember, for a couple months, but I just couldn't get as relaxed, and I found that it's almost as though that with meditation you have to find your own pathway in. This, I show you the path. I take you down the path a few times, and then you can do it. And so it's much quicker to learn that calming, stabilizing sensation in the body when using hypnosis. Meditation was really developed as kind of a self-growth tool, whereas hypnosis was initially used primarily for medical problems, when there wasn't anesthesia, you know, when there was treating someone with chronic pain. So the goal was different. The parts of the brain are different. The part is up in the front that meditation affects, whereas hypnosis affects the limbic system, which is a more primitive part of the brain that helps determine the significance of events that are happening to us, and so it can affect that. Depending on what we're suggesting, it can affect the visual cortex, it can affect the auditory cortex, and when they have done functional MRIs, which are those colored scans that they do of the brain, and they suggest different things to the person who's in a hypnotic state, different parts of the brain light up. There was a study that was done where they were putting the the participant's hand in cold water, very cold water, and the suggestions they were giving with hypnosis, when they suggested that they couldn't feel the cold, one part of the brain would light up, the part that dealt with pain. When they suggested that they could feel it but they didn't care, a different part lit up. And so one of the things that seems to happen with hypnosis, because it involves suggestion as well as being focused and absorbed, we can actually affect different parts of our brains to do different kinds of things depending on what we need. So I think that's a major difference in it. And I also, I sometimes kid and I tell my classes that I think, you know, if the Dalai Lama was there with his monks and he was helping them learn meditation, but if he was giving them suggestions at the same time, it was really hypnosis, because they'd be very suggestible, just being focused and absorbed on something, whether it's breathing or the marble or sounds, being very focused and absorbed and having someone there suggesting certain things that you want to happen, you know, can make it much easier to make those things happen, which is why when I teach classes, I always have the mom has to have a partner, either the dad or someone else who's there with them, because they need someone there that is there all the time that can give them suggestions while they're using hypnosis, which is going to help them be much more successful than if they're just trying to do it on their own. Is that?
Yes,
give me an
definitely.
idea?
Yeah, thank
Okay.
you for the clarification. It's something, you know, you don't necessarily know all the nuances between the two,
Yeah.
so that's very helpful. And we actually have a question from Mary who's watching. So Mary asks, how did you get into hypnosis, and could you expand on how hypnosis works? So maybe even telling us a little bit more about your
Sure.
classes would be great.
Yeah, so initially I got in because I wanted a way to help my moms get through labor without an epidural or pain medication, and much of the pain medication we have only works once or twice and doesn't work anymore, and so moms would get to a certain point and they wouldn't have pain medication to use, so I was looking for something that would get them further before they needed that. And so I started working with a therapist who had been using this for 25 years, and he taught me, you know, how to do it. We worked with some of my patients. Since that time, I've had a lot of training through the American Society of Clinical Hypnosis, which just trains mental health and medical health professionals, and have also done a lot of training for them. So I've had over the past 15 years a great deal of training. Hypnosis, the definition of hypnosis, is a focused, absorbed state where the person who's in that hypnotic state is more suggestible. And so it entails the person who is practicing hypnosis to be very, very focused, absorbed on something. It can be their breath, it can be this music, it can be a marble, it can be one of the artworks that we've shown. It can be anything, to learn to be focused, absorbed, and then during that time that they're focused and absorbed, someone is there helping give them suggestions for what they want. Now, the thing that sometimes gets confusing for those of you who've seen the stage hypnosis is that the stage hypnotists make it look like they're doing something to the person, when in fact, any of those people that are there could just stop and say, you know, I don't want to do this anymore. You know, I want out of it. They totally control it. But when the stage hypnotists are doing it, part of their entertainment is to make it look like they're making something happen. And in fact, that's not the case. So that when I'm working with someone, it's very clear I'm not doing it. I'm kind of their guide. As I tell my couples when I'm teaching hypnosis for childbirth, I'm your outward bound instructor, and I'm getting you ready for the jungles of labor and delivery. You know, and you don't know what you're going to find there. And so by the end of this course, you are going to be ready for whatever happens to come up. And one of the things that helps me with that is I was like an outward bound instructor. I was out for 10 years between undergraduate and medical school working with teenagers. And the things I did with them were teaching them to climb and cave and raft and canoe and winter camping. And so I have a lot of background in that. And so I often will use those kinds of images as to what labor's like. And so that when women are going over contraction, it's really more like a hill or a wave or a gust of wind. Something just like contractions will come and go. And so giving that suggestion to moms when they want something, they want some way to get through those. And so they're very motivated and suggestible. If they're using hypnosis, it's much easier for them to make that happen. So really, like I said before, hypnosis is really a focused, absorbed state. We all go into it if we're in a play or a movie, and we're so absorbed. You know, we have time distortion. We don't realize that we've been there for 2 hours. It seems like half an hour, or we're in a really good book, or we're at a concert where we're very, very absorbed. That's a type of hypnotic state. What I'm teaching the couples to do is to be able to do that at will, like daydreaming or zoning out. We all do that every day. Every couple of hours we zone out for a short time. We couldn't make it through the day as human beings without zoning out periodically. But it's hard to say, I'm going to zone out now, or I'm going to daydream. We don't really have that ability to just say, okay, I've got to daydream now. That's kind of a left brain thing, so it's like, I'm going to think about it and daydream. Well, it doesn't work that way. However, learning self-hypnosis, you can actually get yourself into that state by being very focused and absorbed on something. And depending on how you experience the world, whether you're more kinesthetic or visual or auditory, you can use those kinds of sensory modalities to help focus more. So that's really, hypnosis is pretty straightforward. It seems like kind of this mystical voodoo thing for some people, but in fact, it's something we do every day to ourselves, and as children, we did it really well, but we get kind of schooled out of it. And so when I teach it, I'm really teaching adults to be able to do what they did zone out when they were kids, and to imagine things that they can then use for the things that, to help them get through whatever that may be for them.
So actually, I have a question. Oh, sorry, the lights in my office keep going off. I have a question to kind of follow up on that last comment. I'd love to know if you see, or even Caitlin, if you've seen after any ways that you've used this process or any other kind of applications that you could see this process being useful for, because I know you've talked a little bit about it in a broad sense, and I know obviously it's very important to the labor and the childbirth classes, but beyond that, I wonder if you see any other additional applications for this process of kind of being able to visually connect with something in such a deep way.
Yep. Shall I go first, Caitlin? Is that okay?
Yep.
Okay.
Sure. Yeah, that's good.
Well, when I teach it, and for myself, this is really a life skill. I use it as an obstetrician. I get woken up at night all the time with questions, or if somebody goes into labor, or maybe I'm on labor and delivery, and the beds are terribly uncomfortable, and I can't really go to sleep because I'm going to have to get up in a short time. And so I use this as a way to get rest. And so I may spend 20 minutes just focusing on my breathing. And I find that when that 20 minutes is over, it's almost like I've had an hour nap. It's as restful as having slept, but I'm wide awake, because hypnosis is not a sleep state. It's a very focused state where the body is resting and calm, and so you feel like you've gotten that kind of rest. I think for moms, for many of the moms afterwards, they use it when they have a crazy baby that doesn't want to sleep. And so they're up all the time, and they can't figure out what the baby wants, and they've changed them, and they've given them, they've fed them, they've done everything, and the babies just get irritable as they get used to being out in this world. And so I suggest, and many of the couples will use this as a way to calm themselves down, because they can't do a whole lot. I had one baby that was crazy and one that was really calm, and I remember, I would have really loved to know how to use hypnosis with a crazy one. Because it was difficult, nights just crying and crying and crying, where it was simply that's the constitution of that baby, and so it can be used for that. I used it when my kids were teenagers and they were out late, and I was waiting up for them, and my husband could go to sleep easily. I would sit on the couch and use hypnosis to just rest for however long it took, and then they'd walk in the door, and I'd go like, ha! Yeah. So they didn't like it much, but it really worked for me. So I've used it, like I said, for crowns or for any kind of pain. So it's really, I see it as a life skill to help calm the body, and to, if there's anxiety around something, if there's pain, for sleep. It's a great method, and it's like you can't do it too much. It's like if you get addicted to being too calm, it's okay. You don't have to worry about that. You can't get too much calm.
I like that. Yeah, it's definitely
you can't
something
overdo
to
it
remember in this day and age.
Yeah, you can't overdo it.
Caitlin, did you want to add anything?
Yeah, I feel like I just naturally experience that hypnotic state when I ride my bicycle to and from work, and I don't have to make any choices. That just happens. So that's nice, because I'm out on the trail and there's nature all around me, so it's easy to feel really lulled and sort of hypnotized or calm. But then I have insomnia, or I'll wake up maybe at like 1 or 2 at night, and I can't fall back asleep, and then I get really panicked. And so being able to use that self-hypnosis process helps me, fall back asleep. And to me, self-hypnosis is also about imagination, whereas maybe meditation is like trying not to think anything. Self-hypnosis feels really creative, like, oh, I can use my imagination. So I like that, the creative act.
Wonderful.
Yeah.
And going off of your response to that question, Mary asks, for you, Caitlin, specifically, how did you come across this method?
Oh, well, I was lucky because Columbia St. Mary's led me to Dr. Irland, and that is part of her practice. So, I think you get an introduction to the idea of it, and then Dr. Irland has great classes for couples to go through. You might have like 4 Tuesday nights where you and your partner go and practice these techniques. So for us, it was also a good relationship building opportunity. It helped us figure out as a couple how we were going to go through this labor process. So yeah, Dr. Irland, I was lucky. I just got a great doctor who came to me through word of mouth. I had a good friend who was having a baby, and she said, oh my gosh, you have to try this out. So it was good.
Wonderful, thank
Yeah.
you. Great. So I have some other questions about this practice, and I wonder, Dr. Irland, if you can expand on this idea of left brain, right brain. I think as an arts education professional, we talk a lot about creativity and about left brain, right brain, and kind of how, kind of in a more education sense, how that can be applicable. But I'd love to hear from kind of a more of a medical side view, how that comes into your practice and kind of how that relates to this process too. Because I think those kinds of concepts of creativity and the left brain, right brain could be really interesting for our participants who might not be going through a childbirth process, but something that they could take away from our conversation today.
Okay. Well, one thing, first off, we know that the left brain isn't totally critical and thinking, and the right brain is totally creative. There's some mix there. But it's easy to explain things in terms of that. Although we know it's not quite that simple. We know that there is more creative work going on the right side, and the left side does the critical problem solving and communicates. And so the left side has to be there to communicate what's going on with the right side. So I find for myself, because I'm in a very left-brained profession, I deliver babies, I know medicine, I do surgeries, I'm always solving medical problems, that this has been just really energizing for me. Most OBGYNs in their 60s are giving up obstetrics. And for me, I can't imagine doing that. To spend my day all day doing surgery, and not working creatively with moms and with couples just would not make any sense. And so I'm doing this much longer than many physicians do. And part of it, I think, is because I really enjoy using that other part of my brain while I'm working. And so when I'm teaching classes, I find I'm much more relaxed after teaching a self-hypnosis class to couples, because I don't talk this fast. I'm talking much slower. I'm using a different kind of language. I'm painting, describing metaphors, I'm storytelling, and so it's so different from what I do during the day. Now, certainly when I'm delivering a baby, I may do a lot of that with the mom as well, because she's practiced it, and so it's very easy for her to get into that. But also on moms who haven't been taught hypnosis, I still use the same techniques, suggesting that the contractions are something other than what they are. And so that for me has just been really exciting, kind of the icing on the cake, that after practicing for a number of years, I found something that, like, wow, this allows me to do something more than just be a problem solver, and just a physician who knows medicine. That in fact I can actually help my patients use other parts of them to help heal themselves, because we really can do a lot of healing for ourselves. And I could give you, some examples of things they're not just labor and delivery. I've worked with some of my patients around chronic pain. Many years ago, I had a patient who had juvenile leukemia, and because she had been on steroids for so long, she ended up with what's called femoral head necrosis, where the top of the bone in the leg starts to break down and starts to dissolve, and it's a very painful thing that happens, and then there's less blood supply. And so she came to me asking if she could have some help with the pain that she had. She was in college. She wanted to be able to get around, do things. She was on crutches, on pain medication, and she really wanted to be more of a normal college student. So what I did was I went to someone else who understood what necrosis, avascular necrosis of the femoral head was. It was an oncologist who deals with cancers. And what I realized was, okay, this part of this problem is there because there's inflammation and because there's not blood supply. So then she and I started working with, what kind of story could we tell ourselves about this problem that would help heal that and decrease the pain. And part of it was, what could she do to imagine bringing more blood supply and oxygen, but getting rid of the inflammatory cells? Those cells shouldn't be there, they shouldn't be working, and sending them home. They don't have to work that day. You want to bring in the other cells that have lots of oxygen and nutrition. And so she was very visual. She developed kind of a color scheme where she would spend several times a day going into a hypnotic state and then imagining bringing colors and taking colors away from those areas. So that, and I don't remember exactly what the colors were, but I think the inflammatory colors, the inflammatory cells, I think were red, and the calming cells and the cells that had oxygen and nutrition were blue. And so she would really work on turning all the red into blue. And what she found was, simply by imagining that and going into hypnotic state, which calms things down anyway in the body and helps increase blood supply to all areas, that within a month she had decreased her pain medication and she was off of crutches, which was, to me, was amazing that, that our minds can actually do that simply by imagining, over and over again in this calm, absorbed state, that in fact certain things can change in the body. We can change the automatic part of our nervous system. We can change blood supply, which is what moms do in labor instead of, when they're in labor. Moms, oftentimes, if they could leave their uterus on the table, come back and get the baby later, they do that. But that's not possible. They have to deal with what's going on with them. And while they're in that state of anxiety and fear and they're upset, their body doesn't really know that they're not fighting a bear. It acts the same way, and you don't need your uterus when you're fighting a bear. So we have to, so by calming themselves down, imagining something else is going on, the blood flow goes back to the uterus again. Whereas if they're really, really anxious and upset and they'd like to get out of there, their body is getting ready to help them do that, but they can't do it. And so this allows them to go ahead and reroute their blood supply, in a sense, simply by kind of going into default mode. You can't think it. So the left side of the brain cannot make this happen. The right side of the brain can. And the limbic system, the amygdala specifically in the limbic system, that is what controls the autonomic nervous system. And the right side controls that more than the left side. So that's why you can't think, okay, my pulse is going down, my pulse is going down, my pulse is going down, and have it go down. But if you go ahead and calm things down and start imagining, it automatically happens. So that's really kind of how I look at the left brain thing.
Yeah, that's really helpful. Yeah, and it's amazing how, as you said, how our thinking and our imagination and how kind of committing our minds to thinking in a different way can really affect our bodies as well. I wonder if people are interested in kind of looking into this method more, are there any resources or websites that or books that you might recommend they look into?
I would suggest they go on the internet and they bring up the American Society of Clinical Hypnosis. It's ASCH.net, and they have a huge part of that is for the public to understand hypnosis, to look at where in the area that they live they could contact someone, so that if there is someone watching, who does have a chronic pain problem, or is looking at wanting to have something done because they're having a dental procedure done, another procedure, or they're getting ready for labor, that they can go on, they can find out more, but they can also find a professional who's been trained by ASH because the training is very substantial. You know, you have to go through a certification process, and you have to be licensed in either medical or mental health professional in your state. And so there's a lot you have to go through. So they can trust those people to go ahead and give them good information and also work with them. So that's the place I probably, you know, would suggest.
Wonderful. And I'll make sure to put that link up on our Google Plus page so that you all can access it either after this talk, or if you're viewing this in a later recording, it'll be right on that Google Plus page. Okay. I have one more question for you, but before we get to that, Mary has one other question. She asks, so is hypnosis kind of just a mind over matter method?
I wouldn't say it's mind over matter. It's really using matter, using everything, so that you're using your mind to help to engage with your body. You know, we know more and more in medicine that there's not a disconnect between the mind and the rest of the body. Everything's connected. That our body affects our mind affects our immune system, it affects our blood supply. Everything is connected. And so I see it more as a connection, kind of reconnecting that and being able to have some control over what happens, so that we don't feel like things are happening in our body that we have absolutely no control over, you know, and we can't do anything about that. In fact, we can exert a huge amount of control, but it's not the kind of control that you think about. Okay, I'm going to control my body. I mean, you certainly can do that in, you know, if you're walking or you're running, but you can't control the parts that deal with your immune system, with inflammation, with pain, and so this isn't really mind over matter as much as it is just connecting everything, so that you're connected, and you can go ahead and exert some control over that. And I guess, I mean, again, the exciting thing for me, or one of the exciting things, is that it allows all of us to use. To use more than just maybe our profession, more than just the everyday things, that in fact, you know, we all have the ability to imagine, you know, metaphors, to imagine things, to use. I mean, I don't think of myself as a great artist, but boy, I'll tell you, when I'm in hypnotic state and I'm trying something, I think I am amazing, you know. And if anybody, if I showed anybody what I was, they go like, oh yeah, but to me, it's like, wow, look what I can do, you know, when I'm calm and focused, and these great scenes come up that are comforting and calming, and it's sometimes things that I've been, and sometimes I've just imagined, and so I think it's really more connecting.
And I love that phrase of this idea of connecting. It's actually a phrase we've been using a bit in the course as far as making personal connections with works of art. But I think in this context, it's just so powerful to kind of underline how important it is for mind and body to work in tandem rather than separately, as you were saying. So we are almost at the end. Yes, absolutely.
Can I read something? Because I went and looked up something that one of the people in my class gave me a few years back that I just love. It's by Maya Angelou, and I think this is how I really picture, you know, my work and my life. And it says, I believe in living a poetic life, an artful life. Everything we do, from the way we raise our children to the way we welcome our friends, is part of a large canvas that we are creating. And I think that's really, I mean, for me, that really adds a lot to my life. When I think of everything that I do, you know, is really creating this tapestry. It's not just, things are not disconnected, that everything is connected. And so I look at that every day. I think like, yep, that's what I want to live. That's the way it should be.
That is a fantastic quote. Yeah, I will find that quote and I'll put it up on our Google Plus page as well for those of you watching, so you can save it yourselves. That's a great one. Jacqueline, I wonder if did you want to add anything to any of the previous comments before we start to wrap up?
Well, I just thought of one image that I really had to share, and Dr. Irland, I don't even know if I told you this, but I'm a big fan of the painter Francesco Clemente. There's these beautiful watercolors, actually, and maybe like a couple weeks before I gave birth to Kyriakos, I had this dream, and it was like we were a Francesco Clemente painting, and his head, maybe too graphic, but his head was like stuck coming out, and he was like looking at me, and we were talking, but but I wasn't imagining him or me. It was like this painting. I don't know if literally there is a painting like that, but turns out his head was too big and he did get stuck trying to come out, so that image actually was like a foretelling of what was going to happen. So, but I always think of that specific dream before the baby came. So, yeah.
Wow. Okay.
Wonderful. Thank you. Thank you so much for sharing that, Caitlin. And I will add some images of some Francesco Clemente works on our link list as well.
Yeah, I would appreciate that. That would be great.
Yeah.
I'm like, see if I can find that specific image.
Yeah. So to wrap up our conversation, one thing that we've been trying to ask all of our participants, just as a kind of extra takeaway for our folks watching, is how you like to visit museums, just so we can kind of get together a list of thoughts about how to visit museums. As I said in the beginning, our participants are working to get more comfortable looking at art and visiting museums. So how do you guys like to visit museums? Do you like to go alone? Do you like to go with a group of friends or family? Do you come with like a specific list? Do you have do you like to just wander? Tell us a little bit about how you like to visit museums.
Do you want to go first, Caitlin?
Sure. Actually, Chelsea, I probably have a video out there on YouTube where I'm saying this is how I prepare for a museum visit. But now I like to go with my kid and my husband, and we're actually members here at the Milwaukee Art Museum. So for parents with a new baby, it's awesome because we can just like drive into the garage, leave our coats, come right up, and oh, we're in Wendover Hall, which in a way has a feeling that's very birth related when you're inside. And we love the exhibition, so it's fun. Yeah. With the family, is my answer.
Wonderful. Love that.
Yeah.
Well, and I find I usually go with a group, but then I break off because they're either my husband has to read every single thing in the whole museum, and my kids just kind of run back and forth, and I mean now they're in their 20s and 30s, but they still do that. I find that I wander until something grabs me, and then I'll sit there or look at it. And besides, just looking at, what is it that grabs me about it, I also imagine what's going on in the artist's head when they're doing this. And so I know I started doing that really, I mean, with the George O'Keeffe exhibit where they had the photo and then the painting, and I close my eyes and imagine, so how did she see this? How did she do this? What was going on in there that would cause her to paint this of this photo or of this cliff? And that's what I tend to do whenever I'm going through is I'll if there's something that incites something in me, then I'll look at it and try to figure out what is it that's grabbing me about it, and then what was going on with that artist? How did they come up with this? That's always amazing. I'm always astounded. Sometimes I get like, wow, where did you get this from? What part of your mind or your brain? What was going on?
Absolutely. I do the same thing when I visit museums too, kind of wait for something to grab me and then just really try to figure it out as much as I can. Wonderful. So thank you both so much for sharing all of this with us and sharing your experiences. Dr. Irland, it was really wonderful to learn a bit more about this process. Yeah.
Thank you. Yeah.
So thank you both again. I want to remind our viewers that we do have one very last Google Hangout on air coming up next Tuesday at 1, and that will be on the theme of art and music with H2O Music, aka Marquise and Dwight Gilbert, who are music educators here in Milwaukee, who will be talking about how they use art along with their practice as music educators. But for today, again, thank you so much, Caitlin and Dr. Irland. We really appreciate having you both here. And
thank you.
Everyone, thank you so much for tuning in. Thanks. Bye.
Bye-bye.
Bye. Bye.